for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember,
is on.
Good afternoon and welcome to our NEOC COVID-19 weekly briefing for Wednesday, the 27th day of October 2021. Thank you very much for joining us today. As usual, we continue to update you with what is happening here in St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. I want to welcome back our Chief Medical Officer, Dr. Hazel Laws, who is back with us after a well-spent and deserved holiday, and to thank Dr. Cameron Wilkinson for being the Acting Chief Medical Officer in her absence. I first would like to invite to the podium Superintendent Cromwell Henry to bring us his updates with respect to the regulations for the COVID-19.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening this broadcast via whatever means. The current iteration of the Emergency Powers COVID-19 regulations runs from October 21st until November 4th. No new provisions have been included in these regulations. Therefore, we expect continued adherence to the COVID-19 prevention protocols, which you are by now well aware of. We continue to see new COVID-19 infections trending downwards, which is an indication that you are doing something right. The police and the compliance team continue to work together to ensure that event organizers and bar operators operate according to the terms and conditions of their permissions. Please note that the conditions stipulated are in accordance with the regulations and are intended to keep your staff and patrons safe. To standardize our operations across the Federation, 10 compliance officers underwent a 2-week training course in Nevis and have now graduated and will be deployed shortly in the field. These officers are empowered by the COVID-19 Prevention and Control Act, where at Section 4.5 it states, a compliance team may visit or inspect any business, enterprise, or office, monitor any social event, and issue fixed penalty notices to ensure compliance with the provisions of the Act. A person who obstructs any member of the National COVID Task Force or a member of a compliance team commits an offense and is liable on summary conviction to a fine not exceeding $5,000. We therefore ask that you give these compliance officers your fullest cooperation whenever they enter your business, establishment, or event in the execution of their duties. I will close with my usual admonishment and ask you to remember to always wear face masks when you are in public, maintain a physical distance of 6 feet from others, practice good hand hygiene and other sanitization behavior, and avoid crowds and crowded places, and if possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer, to bring us the Health Emergency Operations Center situation report for today.
Thank you, Mr. Williams, and a warm good afternoon to everyone. This is my first press briefing since I'm back, and I must say I'm happy to be back this afternoon. I want to use this forum to officially express thank you to Dr. Cameron Wilkinson, our Medical Chief of Staff, for covering my desk during the period when I was overseas. I'm extremely grateful for the opportunity of spending quality time with my daughter, and of course for the well-needed break. This was my first real break in 21 months, or almost 2 years, and I appreciated the time off immensely. Okay, so as per usual, I will share with you the Health Emergency Operating Committee's situation report for this afternoon, or for today, Wednesday, October the 27th. Now, ladies and gentlemen, we have been responding to the COVID-19 pandemic for almost 21 months. We've experienced 3 COVID-19 waves of infection. We've done well in terms of containment. We've contained the first and second wave, and the third wave is under control. Now, this third wave started approximately around about August 10th to 15th, and we are still counting cases. Now, this slide shows the 7-day incidence, meaning the newly reported cases within the last 7 days. This is over the last 3-week period. So newly diagnosed cases per 100,000 population. And so you can see a drastic decrease in the 7-day incidence over this last 3-week period. This shows, this is a picture of the wave which started the 10th of August until present, and we are on the other side of the curve. This also shows the actual number, the daily counts over this past week between August 20 to 26, and the numbers are going in the right direction, approaching single digits, and we want to keep it like this. Okay, so between last Wednesday, the 20th of October, to yesterday, Tuesday, October 26th, we've added 57 cases, which is 66 cases less than the previous week, or October 13 to 19. During this past week, we've only had 2 hospital admissions, and that's at the JNF General Hospital COVID ward, and 4 patients have been discharged from the COVID ward during this period. We continue to have a number of recoveries. Up to this afternoon, 180 patients recovered over this past week. No deaths. We've not had any additional COVID-19 deaths. Now, in terms of the status, the COVID-19 situation on the ground, we have now a total of 2,646 confirmed cases of COVID-19, with 421 cases reported for Nevis and 2,225 cases reported SIN kits. In terms of the active cases, 294 active cases being monitored as we speak, 53 on Nevis, 241 on SIN kits. Now, as I said before, the recoveries continue. Patients diagnosed with COVID continue to recover quite nicely, bringing our total to 2,331, with 365 recoveries on Nevis and 1,966 recoveries on SIN kits. As we speak, there are only 7 persons admitted on the COVID ward at the JNF General Hospital with the diagnosis of COVID-19. There aren't any admissions at the Alexandra Hospital as we speak. And the COVID-19 related deaths, the count remains at 21. Now, in terms of the COVID-19 related deaths, we've had 21, 3 reported on Nevis, 18 on SIN kits, and majority were unvaccinated. Now, in other words, if you look at this slide, you realize that if you are over 60, if you are unvaccinated, and based on the data we have, if you have comorbidities, your risk of death from COVID is increased. Now, in terms of the COVID-19 cases, based on our analysis, majority of the cases are unvaccinated. 68.4% of the COVID cases unvaccinated, 8.3% partially vaccinated, and about quarter, 23.4% fully vaccinated. So again, if you are unvaccinated, your risk of picking up COVID-19 is increased. Now, in terms of our vaccination status, we continue with our COVID-19 vaccination program, which started on the 22nd of February of this year. So to date, 24,227 persons are fully vaccinated, having received 2 doses. And so in terms of coverage rate, that makes the coverage rate 72.1% of the adults in our population receiving 2 doses are fully vaccinated, and 76.6% of the adults have received a first dose. Now, as you are aware, we received a kind donation of Pfizer vaccines from the United States government, and we are offering this vaccine to adults and children 12 to 17 years. And to date, 11.7% of our children within that age range, 12 to 17, they have come forward, they have received the first dose, and 8.2% of the children within this age range are fully vaccinated. They have received 2 doses of the Pfizer-BioNTech vaccine. And so our vaccination program continues. So to date, this just summarizes the vaccination coverage rates. Total adults in the population fully vaccinated, 72%. Total children, 12 to 17 years in our population that are fully vaccinated equals 8.2%. Now, when you look at the total number of adults fully vaccinated, total number of children fully vaccinated, and you put that over our total population, that gives us the percentage of the total population fully vaccinated. That equals 51.3%. Now, ladies and gentlemen, this is a success. The percentage of the total population in our federation fully vaccinated, 51.3%. Now, when you look at the latest information coming out of the World Health Organization, all territories around the world are asked to achieve the WHO call to action to have at least 40% of its population vaccinated by December 2021. And it's with good news we share with you that the Federation has surpassed this target, this cut point, this benchmark. And I dare say we surpassed this benchmark round about the end of August, early September of this year. The Pan American Health Organization will be acknowledging the Federation's achievement by publishing an article on the Federation's strong leadership in the vaccine rollout. So actually this is a success story. St. Kitts and Nevis is the first independent territory in the Caribbean sub-region to cross this benchmark. And this article will have a global reach. Now, in terms of the vaccination program in schools, the Ministry of Health is collaborating with the Ministry of Education in educating our parents and our students about the COVID-19 vaccines. And so we are targeting the PTA meetings, and we've done so over the past 2 weeks. Now, schools are given specific dates when the children can come into the nearest health center to receive the vaccine. However, we want to recommend that parents and guardians, please feel free to bring your child in on any clinic day without an appointment. So you can come into any health center Monday to Friday, and even Saturday and Sunday with your child to receive the vaccine. So you do not have to wait on an appointed date or time when the school has an appointment to come into the health center. Now, this news came out yesterday. The FDA advisory panel okays Pfizer's vaccine for children aged 5 to 11. So a smaller dose of the Pfizer-BioNTech COVID-19 vaccine cleared its first regulatory hurdle yesterday, October the 26th, for use in children as young as 5 to 11 years. The Food and Drug Administration Advisory Committee voted to recommend it for emergency use authorization for children within this age band. The FDA is expected to make a final ruling in the coming days. So, what is a COVID-19 vaccine booster? Now, a COVID-19 booster shot is really an additional dose of the COVID-19 vaccine given after the protection provided by the original shots has decreased. So the booster is designed to help persons maintain an adequate level of immunity for a longer period of time. So the booster shot is really meant to provide that additional coverage in terms of immunity to protect you against the virus, the SARS-CoV-2 virus that is undergoing innumerable mutations. What is a third dose of the coronavirus vaccine? So a third dose is, as it says, Most of the vaccines to date have 2-dose regimens, so the AstraZeneca, the Pfizer-BioNTech, and the Moderna. So in terms of the mRNA COVID-19 vaccines, if you would have received the previous 2 doses, you can get a 3rd dose, which is identical. The same amount of the vaccine will be administered. So the 3rd dose is identical to the previous 2 doses. It can help protect persons with weakened immune systems who did not have a strong enough response after the first 2 doses. Persons can get a 3rd dose as soon as 28 days after a 2nd dose. So within, let me just add, who gets this 3rd dose? So the COVID-19 vaccine booster shots or 3rd doses are available, will be available for persons who would have completed the initial series and 6 months would have elapsed between the 2nd dose and present. And so persons who are elderly, persons who are 65 years and older, persons who are vulnerable. So adults who live in long-term care facilities like nursing homes and prisons, adults who have underlying medical conditions like cancer, autoimmune disease, and persons who are maybe taking steroids for other medical conditions. Adults who work in high-risk settings, so like persons like healthcare workers who work on COVID wards, etc., or frontline workers in high-risk settings. These are the individuals who are targeted initially to receive booster shots or 3rd doses. Now, what is long COVID? So, ladies and gentlemen, we have a number of persons who would have been diagnosed with COVID-19 and they would have recovered. But more and more of these individuals are voicing complaints in terms of symptoms. Even though they've recovered, they are still experiencing some lingering symptoms. And so the Lancet, a renowned medical journal, just published an article referring to a new study on this topic, long COVID. And they found that about half of the individuals or COVID-19 patients who were hospitalized had lingering symptoms for as long as 1 year. So please note, however, most COVID-19 survivors have good physical and functional recovery right after, right? So what they found is that during the 1 year follow-up, most of the survivors, they recovered, no problems. However, some of the survivors continue to experience long-term health consequences of COVID-19. Please note that the most commonly reported symptom in terms of long COVID is fatigue and muscle weakness. So in other words, persons who would have recovered from COVID, it won't be unusual for them to complain of lingering fatigue, malaise, muscle weakness. Some complain of shortness of breath, sleep difficulties, palpitations, racing of the heart, hair loss, pains, general aches and pains, joint pains, some discomfort in the joints and muscles, and a proportion of these individuals complain of mental and psychological problems, including anxiety and depression. So these are just some of the symptoms being experienced by the COVID-19 survivors. So this is something that we want our people to look out for. Don't hesitate. Try and reach out to your regular primary care physician if you are experiencing any of these symptoms. We want you to also continue to boost your own immune system even after you would have had your negative test and you are officially recovered. We want you to continue boosting your immune system in terms of eating your fruits and vegetables, your supplements, your vitamins C, and your magnesium, zinc, and the other supplements you would be taking. So we want you to continue to boost your own immune system. And of course, getting adequate rest. Exercise is also important. Adequate sunlight. These are the things that's going to help you in terms of your recovery. As I said before, the study found that half of those who were hospitalized had lingering symptoms 1 year after. But please note that more work is being done to characterize the natural history and pathogenesis of the long-term health consequences of COVID-19. Now, on October the 22nd, we had the 9th meeting of the International Health Regulations Emergency Committee regarding COVID-19. So now that committee unanimously agreed that COVID-19 pandemic still constitutes an extraordinary event that continues to adversely affect the health of populations around the world. It poses a risk of international spread and interference with international traffic and requires a coordinated international response. The committee concurred that the COVID-19 pandemic still remains a public health emergency of international concern. The committee went on to make a number of regulations and recommendations to state parties or territories throughout the world. State parties like the Federation, we are advised to regularly adjust our response strategies. We need to monitor our epidemiological situation, assess our vulnerabilities, including our health system capacity, as well as considering the adherence to and attributable impact of individual and combined public health and social measures. What I want to underscore is the importance of the use of the face mask, physical distancing, maintenance of adequate hand hygiene, and ensuring adequate ventilation of indoor spaces, because these remain key factors in reducing the transmission of the SARS-CoV-2 virus. The last statement emphasizes the fact that we are on the right course. Each country, each territory across the world, we are admonished to continue our contact tracing, quarantine, isolation. These measures must continue to be adapted to the epidemiological and social context and enforced. So we are on the right track, and this is obvious because we've been successful in containing the first 2 waves, and the 3rd wave is already under control. Ladies and gentlemen, these are the measures we must continue. We need to accept the vaccine. There are still individuals who are waiting and seeing in terms of the vaccine. We want you to empower yourself with all the information and come on board, because you realize that the unvaccinated, you are vulnerable. You are at risk of picking up the virus, and your risk of severe disease and death is increased just by being unvaccinated. We want you to wear your face mask at all times. Maintain hand hygiene. Ladies and gentlemen, these measures work because there are those of us who took the chance or the calculated risk of traveling. So we traveled to destinations where you even had the other variants of concern in circulation. And these are the measures, along with your vaccination status, that protected us. And we came back, we tested negative. And so these measures work. October, Breast Cancer Awareness Month. I'm going to pause at this time to acknowledge the breast cancer survivors in our population, they are learning to live with COVID-19 along with fighting breast cancer. So they are fighting two battles, the COVID battle, COVID-19, and the breast cancer. And so we want to reach out to them and big them up at this time. Thank you.
Thank you very much, Dr. Laws. I acknowledge with us the Honorable Wendy Phipps, the co-chair of the Disaster Mitigation Council. Welcome, Honorable. Mr. Samuel will not present today. I do not have any questions that were sent in, and so therefore we are going to have an early day today. 19 weekly briefing. We continue to update you with what is happening here in St. Kitts and Nevis. And of course, you are a key part of the management of the pandemic here in the Federation. I want to thank Dr. Laws for her presentation and Superintendent Henry. I also recognize Dr. Cameron Wilkinson. He is always here, and we thank him very much. He had no question to answer today. And we thank ZIZ and all media outlets who continue to do their part in helping us in the fight against the transmission of the COVID-19 virus. We thank Mrs. Christmas Jacobs for her dedicated service of sign language. Thank you very much, Mrs. Christmas Jacobs.
They have to say and the role they want you to play. Easy.
Early in January this year, our federation woke up in fear because a little virus out there in Wuhan was slowly making its way to our land. They say its name was SARS Corona, and our lives it planned to devour. So we're here to come up quickly with a little plan to save our beautiful nation.
If it's a plan they want, then plan they will get. Because of people's lives we have to protect. Close down the airport and send back them big tourist ships so we could focus on this pandemic. Mr. MCS, I'm begging you please, as I pray to God from down on my knees. Now let's get all our hospitals and staff in order to battle this corona.
Well, Madam COO, I hear you loud and clear. We will win this fight, don't worry, don't fear. I'll sound the alarm and get all hands on deck. This war we will win and our people protect. To win this war we must flatten the curve, but don't overwhelm the nurses and doctors. Personal responsibility you must take indeed if we are to succeed.
Cover your mouth, we say cover your nose. This will stop the spread to those who are close. Lock yourself inside during the curfew. Under quarantine, to thine own self be true. Wash from your elbows down to your hands with soap and water, it's a simple plan. If you follow these simple instructions daily, from this virus we'll soon be free. Easy. Now I know what you're thinking, but I only assisted with the recording. This song is not my composition, but brought to me by Dr. Wilkinson. Between Hillis Roy and the CMO, they've come up with this great KISO. So after whipping COVID-19 behind, there'll be Sugar Mass 49. Easy.